diabetes aspect, that's a personal love of mine. Is something I actually hate is diabetes because it affects everything, from your cardiovascular system, your vision, your hands, your kidneys. It's a horrible disease, and the fact that bariatric surgery is a proven cure in some people, significant improvement in most people is something very interesting to me, and why it's happening. And so we're working at the molecular level, animal level, trying to figure out what we're doing and how it's affecting fat signaling, insulin signaling, and things like that, how the liver's metabolizing sugars, why you're getting fatty liver in some of our patients. And this is a lot of our active studies with Dr. Sadek and at the Rutgers School of Medicine to try and understand the elemental reasons of why people are getting disease and how we are fixing them. So we know we're fixing them, but we also kind of want to know why. And this is current literature. And there are different techniques that have different outcomes as well. And Dr. Kudov will talk about a single anastomosis duodenal switch, which is probably the ultimate metabolic operation. So the gastric bypass, the sleeve gastrectomy, the duodenal switch are fantastic ways to improve your metabolic health. And improve your metabolic health basically leads to everything else getting better and preventing these things from happening.
So one of my professional interests has been treating refractory obesity or extreme obesity. We all in this practice have a passion for treating this disease process. It's what part of our name is, Advanced Surgical and Bariatrics. And the reality of this disease is it is a lifelong disease. And for some patients, just like any other medical disease, it requires progressive therapy. And sometimes that starts with diet, exercise, medication, starting with a surgical technique next. But in some patients, when their disease is that aggressive and that extreme, we have to escalate the surgical therapy too. And we are seeing that over time, there are going to be some patients out there who need a step up in their previous surgical therapy to another stage. And in those cases, we have to try to really give these patients a more powerful tool, even than their original surgery, to advance to the next level of treatment. And in many patients whose disease is refractory or stubborn or unresponsive or not as responsive as we wanted it to be, we can escalate therapy by converting one procedure to another. And in some patients, that means converting a sleeve gastrectomy to a gastric bypass. So sometimes that means converting a bypass to a more distal bypass. And in some patients who've had a sleeve, we are actually performing a modification of the duodenal switch procedure, which traditionally has been performed fewer than 1% of the time in other practices. And in our practice, we're able to now incorporate this pretty advanced technique with both laparoscopic and robotic approaches. And it augments the previous sleeve procedure, allows substantial additional weight loss over a longer period of time. It shows an improvement in diabetes control substantially, even in patients who have had previous increases in their diabetes despite therapy. And so this is a technique, I think, that is setting us a little bit apart from a lot of groups, is that we can provide the full spectrum of bariatric surgery, from the endoscopic approaches to the traditional sleeve gastrectomy, gastric bypass, but now we can incorporate duodenal switch and modify duodenal switch as part of our armamentarium against severe cases of obesity.